Hi everyone, my name is Dinesh Sarasena, and today we're going to be talking about imaging the posterior aspect of the elbow. As with previous talks, I really recommend the ESSR guidelines for elbow imaging and ultrasoundcases.info. Both are excellent resources. So here are the images from the ESSR guidelines for scanning the posterior aspect of the elbow. The patient can have their elbow bent at 90 degrees with the hand resting on the surface of the examination couch. This exposes the posterior aspect of the elbow, and if you start scanning in a longitudinal axis, you'll see the triceps muscle, the triceps tendon attaching onto the olecranon, and beneath the tendon you will see the posterior fat pad and the joint line. Often when I'm scanning patients in clinical practice, I'll either have them seated with the hand placed on the examination couch and bent in the same orientation as the ESSR guidelines, or I will have them lying on their side and have their elbow bent again and the hand placed on the examination couch. This latter position tends to be a lot more stable and comfortable for the patient. When scanning the posterior aspect of the elbow, I typically start with the transducer in a long axis orientation. As mentioned, when the patient is lying on their side and has their elbow tucked behind them and the hand placed on the examination couch, it tends to be a lot more stable than if they're seated with the hand resting on the examination couch. And again, this is the image that you'll see. You'll see the triceps tendon attaching onto the ulna or the olecranon. You'll see the triceps muscle with the posterior fat pad beneath it and the humerus underneath. It's also useful to turn the transducer and examine the posterior aspect of the elbow in the short axis. This is the image that you will typically see. Again, we have the triceps muscle or tendon over the top. We have the posterior fat pad and the humerus beneath. This is a good orientation to look for any effusions or other pathologies in the posterior aspect of the elbow. Thanks for watching. I hope you found the video informative and it adds to your knowledge of ultrasound imaging. If you did, please remember to hit the like down below and follow the channel for further updates. You can also follow me on Twitter and Instagram. Please also remember to check out sportsmedinfo.sg. Thanks for watching, and I hope to see you all very soon.